Jordan?
Yes, Amman.
From Amman. Excellent. So how did you come to work for SAMS, and especially in the PSS Center?
Yes, I studied nursing in bachelor degree, then I studied master degree clinical psychology. I was studying during the crisis, Syrian crisis. After Syrian crisis, after I graduated from my master degree, I was looking for a job. So I now with SAMS. SAMS is one of the best organizations inside Jordan.
Mm-hmm.
Yes, in mental health especially.
Mm-hmm. So what is distinctive about SAMS? Why did you choose SAMS?
I was work with Save the Children, SAMS, but I come back to SAMS because I feel comfortable now here. Yes.
So you said they are probably one of the best in mental health.
Yes.
Why is it the case? What makes SAMS so different?
Yes, SAMS working on 4 levels on mental health with PSS at the beginning, and then with individual therapy, group therapy, and medical or pharmacological therapy for mental health. This make it like holistic or yes, understand to me?
Yeah.
This is make the specialist more comfortable. Once you need to refer the patient from individual to group or from a group to medical, this is more easy.
Excellent. So if you were to describe your activities, your daily activities to someone who doesn't know anything about your work, how would you present it?
I'm a coordinator
Okay.
in SAMS, Amman and Zaatari, PSS and mental health. So we are working as on outreach. We are home visits and mapping inside Amman, Irbid and Zaatari. We have social workers and outreach and volunteers do this work. This is the first. Second, we have support groups for mothers, children, and males, workshops for adult males and females. We have also group therapy. Now we are building group therapy. But also individual therapy. We do individual therapy for male, female, pediatric children. Yes, and medical.
Okay. Excellent. So you mainly work in coordination, or do you provide services yourself?
No, I provide services.
Okay.
Yes, I do coordination on my team, but I do my special, individual therapy, not group therapy till now. Yes, I was doing my group therapy before, or support groups before, but now I'm just with individual therapy. Yes, I work with children and work with adults.
Okay.
Yes.
So can you tell me more about this? So these individual therapy sessions.
Most of cases in SAMS is trauma-related cases. We can deal with any case, but we concentrated on trauma-related. So we are working with PTSD, with depression, anxiety, OCD. This is the main in our centers. With children, the symptoms and signs and symptoms is different from others. So we work with enuresis, natural enuresis, work with fears. These symptoms or signs of trauma. So I use play therapy with the children, art therapy with children also. With adult, mostly CBT or projects. Yes, sometimes. Yes, this is the main.
The details of it. So technically, what are the activities that you're proposing to the children? What are the type of things you ask them to do?
8 paragraphs or questions directed to the trauma. We do it before you start healing or treating. Then after, if it decreased less than 17, the patient will be good.
Okay. Can you tell me more about the cases of those people affected by the war? What did they go through?
Yes, the people. He was a child. He was in Syria, inside Syria. At the beginning, he was, Deir Zur. Yes. Deir Zur was with Daesh at the beginning. So they affecting by Daesh, then affecting by the Syrian. Yes.
Assad.
Yeah, Al-Assad. Yes. They admitted to his home. They gave him a mishari, and he was 5 years just. And they took him to the street. Then he was in make changes in his mind, in his brain. Also, he was just 5 within that. So the symptoms was avoidance, enuresis, fears. The first phase was indirect play to build a relationship. Second phase was to remember the event, but the whole event, not in PTSD they remember just single things or something, not all event.
I see. So you mentioned this indirect play. So how does that work technically? If you can give me an example of something you would do with her?
Indirect?
Yes.
I use indirect play because the children, once they come to treatment, they are not. You cannot talk to him as you talk with adult, or deal with them as you deal with adult. So at the beginning, I took him to the playroom and tell him, now you have the choice to do anything. Yes. At the beginning they didn't, but then they took familiar with this room. Not the first session, maybe in second or third session, they get familiar with this, with the room, with the playroom. This help him to understand that they can choose. They are not tools like what happens in real life. They are not tools. They are human beings. They have a choice. After 2 or 3 sessions, they came from outside to direct to the playroom and said, "I need to play with this tool." This is help him to do decisions, to make decisions, to understand themselves, to know what they love, what they hate, and also build a relationship between you and the patient. Yes.